This is Monterey on Tonight. I'm Gary Morris. This is show number 76.
Wow.
And I want to welcome my first guest of the evening. And this gentleman is a doctor.
That's correct. My name's Dr. Duncan McCollum.
Oh, there you go.
Yeah.
I didn't have to do it.
No, I've been a chiropractor in Santa Cruz for 35 years.
You've been in the area of Michael Zwirling.
Correct, yeah.
That's how I met him.
Yeah.
MZ.
MZ, who's going around the world right now.
He's on a great cruise.
Yeah.
And talked to him yesterday. And
Good.
The next stop on that cruise is Cape Town, South Africa.
Wow.
They're on their way.
That sounds like fun.
Oh, yeah.
Yeah.
I mean, come on. I said, are you getting bored yet?
No, he's able to sing there. He's happy as a clam.
He's doing his karaoke now. He's having a ball.
Yeah.
Yeah. So anyway, we met, Duncan and I, at MZ's residence.
Correct. Yeah, over
at
Christmas.
Monterey at Christmas.
Yeah.
And I said, come on and let's talk about your line of work, because it is an interesting field he's in. And, well, tell us a little bit about it.
Yeah, chiropractic has been around since 1895, believe it or not. A lot of people don't realize that. And it is based on the body's ability to heal itself. That's the number one focus, is the greatest physician, whoever lives right inside of you.
Yep.
And your body needs no help. It just needs no interference.
No interference
So
from the outside world.
Yeah, exactly. Our goal is to get the interference out of the body so that it can heal. And there's many different things we do. One of the things that I was talking to you about is one of the biggest problems people are coming up with right now is this condition called peripheral neuropathy.
Peripheral neuropathy.
Yeah, it's like,
I hear neuropathy a lot.
Right. And so peripheral would be like the central nervous system is inside the house.
Okay.
Your peripheral nervous system is like if you walk outside the door and you're in the garden.
Okay.
It's the periphery of your house. So it's all your fingers, all the way down to your toes. And a lot of people are getting conditions where they get numbness, tingling, burning.
Yeah, I've heard that.
Difficulty walking. Afraid to drive because they can't feel their gas pedal from the brake.
And where is that coming from? Is that the internal body doing that?
It's such a great question. At this point, I realize that, how all roads lead to Rome?
Yes.
All chronic disease leads to peripheral neuropathy.
Peripheral neuropathy.
Peripheral, like the periphery. Yeah, and it's like diabetes is the number one cause of it because the blood vessels get clogged up at the tips of the toes, and you need oxygen to live. So when you don't get oxygen to an area of the body, that's when the areas the nerves start to die. And so you start to lose the feeling, and like if you lose oxygen to your heart, that's obviously a heart attack. You lose oxygen to the brain, that would be a stroke. The thing with the peripheral neuropathy is it's insidious. It starts and you just kind of wonder what's going on. It comes and goes, and then it's there. And there's a really good solution for it. I mean, I've come across a way to actually help people with this, that the typical treatment is to mask the symptoms with medication. That is the typical thing that's done. And we found that there's a way to actually handle this by increasing the blood flow, reestablishing communication from the toes and the hands to the brain via something called biofeedback. And also this other machine I have, which is called a soft wave therapy or a stem cell machine. So it's great. We've been getting great results, and I'm really happy that maybe some people out there are suffering from this. They can actually know that there might be help.
I see. You're a future doctor at the health centers, it says here.
Health centers of the future. Yeah, that's...
What is that?
So Dr. Dan Pompa, who, if you don't know about Dr. Dan Pompa, you should. He is probably the leader in cellular healing and cellular detox on the planet. And I'm one of about 30 doctors that have been working with him for 7 years now. And we all do a lot of the experimenting on ourselves so we can make sure that what we do is going to work for the masses and for the people. The number one, there's three things that cause chronic inflammation. and chronic inflammation causes chronic disease. So it's hidden infections, molds, and then heavy metals. Believe it or not, heavy metals come down 4 generations through your mom's umbilical blood.
Wow.
So if your great grandma had silver in her teeth, that mercury will go
into the entire body.
Yeah. And let's say your great grandfather was a gold miner. Well, mother probably,
picked up some of that.
She washed the clothes and got the mercury that they used to extract it. So
and
anyway,
you can tell when someone comes into your office and has an examination, do you do blood work on them?
We can, but blood work isn't the right thing to do for the heavy metals.
Okay.
It's more of what we call a provoked urine test. So most of these metals are so embedded in our brain and our body that they're just not readily available in the bloodstream or the urine, because if it was water soluble, it would kill you. So the body hides it in fat cells. And guess what's made of fat? Been called a fathead. Well, there you go. So
now,
anyway,
you've been practicing quite a number of years.
Yeah, 35 years.
35 years. And has it always been in the Santa Cruz area?
Yeah, I started there, and right after the earthquake.
Right after. So where is your office located?
It's in Capitola, where the Trader Joe's. There's a few. The big mall.
So
there.
you're easy to find.
Yeah, I'm pretty easy to find.
And there's your website.
Yeah. And there's my staff.
Is that your staff?
Yeah.
Let's stay on the picture there.
There we go.
We can tell everyone out there in TV land who these folks are.
Yeah.
Who's on the screen here?
Well,
there's you.
Oh, there I'm adjusting a little baby that's probably 2 weeks old at that point.
Oh my goodness!
And there's
There's that word.
There's peripheral neuropathy. Yeah, this is amazing. This is called a stem cell machine or a soft wave machine.
And what does that do?
It makes
Duncan.
It actually will pull your own stem cells into your tissue. So if you have a knee problem, when we use that machine on your knee, it will actually increase blood flow, push out toxic pain chemicals, and bring your own stem cells in. We have our stem cells in our body all the time.
Yeah, and you're doing a lot of that work now.
Yeah.
With stem cells.
A lot of people don't.
And that's stem cells from our own body.
Yeah. People may not know a stem cell is like when an egg and sperm come together. That's the original stem cell.
Wow.
And that one cell splits, and right now we have 75 trillion cells in our body.
Phew.
All from that
Goodness
one,
gracious.
and all the DNA and everything is in there, so it knows what to become.
People that need to have help because maybe they have neuropathy, they would come to you.
Exactly.
And you can help them.
Yeah, we have first thing we would do is take a thermographic image of their hands and feet, and it will show whether you're losing oxygen there. So that's the first thing we do, yeah. And they can find us at our website, McCollumWellness.com, and or call the office. It's in Capitola. There we go. McCollum Chiropractic, and it's 831-459-9990.
Is it there on the screen? Yeah, there it is.
is.
Call today.
Yeah.
Give them the number one more time.
831-459-9990. Now, the cool thing I just want to say about this peripheral neuropathy thing we're doing is I was at first could not believe what the other doctors were telling me, the results they were getting. I mean, these patients that have this, they're given medication and just letting the condition worsen. There's no hope, but we're turning it around. As long as it's even up to 80% loss of sensory, we're seeing results within a few weeks. It will take months to get it
Wrong
back.
name on the screen there, Rachel.
I'm running for
You're
America.
running for There you
and
are.
I
That's
sing.
the right
I
name.
sing. I'm going to sing for my.
That's the right name, Duncan McCollum,
That's
chiropractor. Right. And you're much more than just a chiropractor. You are beyond chiropractor now. You're doing some space age things.
By being with Dr. Dan Pompa and Health Centers of the Future, we are basically always looking for the upstream cause of the problem, which is in the brain typically.
Yeah.
And all the autoimmune disease, when genetic things turn on. Here's a really interesting thought. We all have genes in every cell.
Right.
And the genes are like a library. And the librarian will come pull a book off the shelf and open it up and read it.
Mm-hmm.
That's what happens to your genes.
Uh-huh.
So when the bad genes gets pulled off of the shelf or bad book and read, you express that condition. Toxins turn on the bad genes.
That's what is a very interesting point.
Yeah.
And I hadn't heard that before.
Yeah, well, very few people do. Most people aren't trying to get to the true source of the problem, which is, again, molds, heavy metals, and hidden infections.
Well, you make a lot of sense to me. That's for
thanks.
darn sure. And you are available. You're taking new patients.
Yeah, we are.
And all they have to do is reach out to you at that number or go to your website. And
yeah.
that's a great number. Duncan, how did you get that great number? Did you know someone at the phone company?
Yeah, I inherited it. But I don't know, this Tuesday, we're doing what's called a lunch and learn workshop on peripheral neuropathy at my office.
Wonderful.
So anybody
people can
call.
come in?
They can call and make ask because
appointment to come in?
we might be filled, but if they're interested, we will be doing another one. We're actually going to go and we'll do the image there of the hands or feet as a courtesy, just to see whether or not we're in the ballpark of that you do actually have something that we think we can help.
And you know what's interesting? This gentleman is also doing radio.
Yes, I've been on radio for 5 years now.
You've been working with KSCO.
Correct.
And
Michael
MZ.
Zwirling, yeah.
And now tell us about your program.
So it's called McCollum Wellness Radio, and it's on every Saturday from 1 to 2, and then 3 to 4 on Monday.
Okay, so twice a week.
It's a repeat on.
Okay, so one is live.
1 to 2, yeah.
1 to 2 is live.
And it's always talking about the latest stuff that I come across, usually with Dr. Dan Pompa or Dr. Dan McCollum, who is the guy that's doing the peripheral neuropathy stuff. But I don't stop learning. To me, there's new stuff out there all the time, and I need to find it so I can help other people.
You impressed me the first time we met by you knowing so much about your industry, and that's why I invited you to be a guest on the show. Because
thank you.
We want our audience to become familiar with you.
Yeah.
And so if you need to see Dr. Duncan McCollum, all you have to do is reach out to him at his website or call the office and make an appointment to go in. And I love the fact that you're using the stem cell approach, too.
Yeah, and by the way, with peripheral neuropathy, we can do it remotely. So
really?
Yeah, some of the equipment we use, we send. You're going to do it at home anyway.
Wow.
So we do this with people all over the country.
Now, that's a first.
Yeah, it's pretty cool.
Yeah, that is cool.
Yeah.
Well, Duncan, thank you for making the drive over from Santa Cruz. I appreciate you being here tonight.
Yeah.
I learned a lot. I hope you folks did out there in TV land as well.
Yeah, absolutely. Been fun to be here.
And guess what? You're the first doctor of chiropractic I've had on the show.
Wow, awesome.
And 76 shows.
That's very cool.
That? So,
yeah,
number
appreciate
one.
it. Yeah.
Thanks for coming tonight.
Yeah, you bet. Thanks a lot.
All right,